Welcome! Today we're diving into a common foot condition that affects millions worldwide, plantar fasciitis. If you've ever experienced sharp pain in your heel, especially when taking your first steps in the morning, you might already be familiar with this term. Plantar fasciitis can impact daily life, making walking or standing uncomfortable. In this video, we'll explore what plantar fasciitis is, why it happens, and how doctors diagnose it. Let's start by understanding the basics before moving on to symptoms, causes, and the diagnostic process. Plantar fasciitis is an inflammation of the plantar fascia, a thick band of tissue that runs along the bottom of your foot, connecting your heel bone to your toes. This tissue acts as a shock absorber and supports the arch of your foot. When it becomes irritated or inflamed, it can cause significant heel pain. The discomfort is usually most noticeable with the first steps after waking up or after long periods of rest. Understanding this condition is the first step toward effective management and relief. Let's take a closer look at the anatomy involved. The plantar fascia is a strong, fibrous band that stretches from the heel bone, known as the calcaneus, to the base of your toes. It supports the arch of your foot and helps you walk by absorbing shock. When this tissue is overused or strained, tiny tears can develop, leading to inflammation and pain. This is why plantar fasciitis is common among runners, people who stand for long hours, or those with improper footwear. The hallmark symptom of plantar fasciitis is a sharp, stabbing pain in the bottom of the heel. This pain is often worse in the morning or after periods of inactivity. As you move around, the pain may decrease, but it can return after long periods of standing or after exercise. Some people also experience stiffness, swelling, or a burning sensation in the affected area. Recognizing these symptoms early can help with prompt diagnosis and treatment. Certain groups of people are more likely to develop plantar fasciitis. These include athletes, especially runners, people who are overweight, and those who spend a lot of time on their feet. Wearing shoes with poor arch support or walking on hard surfaces can also increase your risk. Age is another factor, with plantar fasciitis being most common in people between 40 and 60 years old. Understanding these risk factors can help in prevention and early intervention. Plantar fasciitis is usually caused by repetitive strain or overuse of the plantar fascia. Activities that put a lot of stress on your heel and attached tissue, like long-distance running, ballet dancing, or standing for extended periods, can lead to this condition. Other causes include having flat feet or high arches, tight calf muscles, or wearing unsupportive shoes. Sometimes the cause isn't clear, but the result is the same: inflammation and pain. Why is the pain from plantar fasciitis often worse in the morning? During sleep, the plantar fascia tightens up. When you take your first steps after getting out of bed, the sudden stretching of the tissue can cause sharp pain. As you continue to move, the fascia loosens, and the pain may subside. This pattern is a classic sign of plantar fasciitis and helps distinguish it from other causes of heel pain. Not all heel pain is plantar fasciitis. Doctors must consider other conditions, such as heel spurs, Achilles tendonitis, or nerve entrapment. Each of these has different causes and treatments, so accurate diagnosis is important. By understanding your symptoms and medical history, healthcare providers can narrow down the possibilities and focus on the most likely cause. When you visit a doctor for heel pain, the first step is a thorough medical evaluation. The doctor will ask about your symptoms, when they started, and what activities make them better or worse. They'll also review your medical history and any previous foot problems. This information helps guide the next steps in diagnosis and treatment. A physical exam is a key part of diagnosing plantar fasciitis. The doctor will examine your foot, pressing on different areas to pinpoint the source of pain. They'll check for tenderness along the bottom of your heel and arch, and may ask you to flex your foot or stand on your toes. These tests help confirm whether the plantar fascia is the source of your discomfort. The specific location of your pain can provide important clues. With plantar fasciitis, the pain is usually centered at the bottom of the heel, right where the plantar fascia attaches to the heel bone. If the pain is elsewhere, it may suggest a different diagnosis. This is why doctors pay close attention to exactly where you feel discomfort during the exam. Doctors also assess the structure of your foot. Flat feet, high arches, or abnormal walking patterns can increase stress on the plantar fascia. During the exam, you may be asked to walk or stand in different positions so the doctor can observe your gait and foot alignment. These observations help identify contributing factors and guide treatment recommendations. In most cases, plantar fasciitis can be diagnosed based on symptoms and physical exam alone. However, if the diagnosis is unclear or if symptoms persist despite treatment, imaging tests may be ordered. X-rays, ultrasound, or MRI can help rule out other causes of heel pain, such as fractures or soft tissue injuries. Imaging is not always necessary, but it can provide valuable information in complex cases. X-rays are often used to rule out bone problems, such as stress fractures or heel spurs. While heel spurs are sometimes seen in people with plantar fasciitis, they are not the cause of pain for most patients. X-rays can help confirm that there are no other underlying bone issues contributing to your symptoms. Ultrasound and MRI are advanced imaging techniques that provide detailed views of soft tissues. Ultrasound can show thickening or inflammation of the plantar fascia, while MRI can reveal more subtle injuries or tears. These tests are usually reserved for cases where the diagnosis is uncertain or when symptoms do not improve with standard treatment. Unlike some other conditions, plantar fasciitis does not require blood tests for diagnosis. Blood work is only necessary if your doctor suspects another underlying issue, such as infection or systemic disease. For most people, a careful history and physical exam are enough to confirm the diagnosis. To diagnose plantar fasciitis, doctors look for a combination of symptoms and exam findings. The most important criteria include heel pain that is worse with the first steps in the morning, tenderness at the bottom of the heel, and pain that improves with movement. Imaging is only used if the diagnosis is uncertain or if symptoms persist. Doctors must rule out other causes of heel pain before confirming plantar fasciitis. Conditions like tarsal tunnel syndrome, stress fractures, or arthritis can mimic the symptoms. A thorough exam and, if needed, imaging studies help distinguish between these possibilities and ensure the right treatment plan. Your personal history plays a big role in diagnosis. Doctors will ask about your daily activities, exercise habits, footwear, and any recent changes in routine. They'll also want to know if you've had previous foot injuries or medical conditions that could contribute to your symptoms. This information helps tailor the diagnosis and treatment to your unique situation. Doctors often ask about your physical activity, as certain sports or jobs can increase the risk of plantar fasciitis. High-impact activities, such as running or jumping, put extra stress on the plantar fascia. Understanding your activity level helps doctors determine whether your symptoms are related to overuse or another cause. The type of shoes you wear can have a major impact on foot health. Doctors may ask you to bring your shoes to the appointment so they can check for proper support and wear patterns. Shoes with poor arch support or cushioning can contribute to plantar fasciitis, so footwear assessment is an important part of the diagnostic process. Gait analysis involves observing how you walk and stand. Doctors look for abnormal walking patterns, such as overpronation or supination, which can put extra strain on the plantar fascia. Identifying these issues helps guide treatment, such as recommending orthotics or physical therapy to correct your gait. Doctors may test the range of motion in your foot and ankle to check for tightness or limited movement. Tight calf muscles or Achilles tendons can increase stress on the plantar fascia. By assessing flexibility, doctors can recommend targeted stretches or exercises to relieve tension and improve symptoms. During the exam, the doctor will press on different areas of your foot to locate the most tender spot. In plantar fasciitis, tenderness is usually greatest at the front of the heel, right where the plantar fascia attaches. This helps confirm the diagnosis and rule out other sources of pain. Although swelling and redness are less common in plantar fasciitis, doctors will check for these signs during the exam. Their presence could indicate a different problem, such as infection or inflammatory arthritis. Careful observation ensures that nothing is overlooked in the diagnostic process. Doctors will also evaluate the arch of your foot. Both flat feet and high arches can contribute to plantar fasciitis by altering the way weight is distributed across the foot. Identifying these structural issues helps guide recommendations for orthotics or supportive footwear. Functional tests may be performed to assess how your foot responds to stress. You might be asked to stand on your toes or walk on your heels. These simple tests help doctors evaluate the strength and flexibility of your foot muscles and the integrity of the plantar fascia. The heel squeeze test is another tool doctors use. By gently squeezing the sides of the heel, they can check for pain that might indicate a stress fracture or other bone problem. In plantar fasciitis, this test is usually negative, helping to rule out other diagnoses. The windlass test is a specific maneuver used to diagnose plantar fasciitis. The doctor dorsiflexes your big toe while you stand on tiptoe. If this action reproduces your heel pain, it suggests tension in the plantar fascia and supports the diagnosis. If your pain doesn't improve with initial treatment, doctors may order imaging studies to look for other causes. Persistent pain could indicate a stress fracture, nerve entrapment, or a tear in the plantar fascia. Imaging helps clarify the diagnosis and guide further management. Orthotic devices, such as custom shoe inserts, can help relieve pressure on the plantar fascia. Doctors may recommend these if they notice structural issues during the exam. Orthotics provide extra support and cushioning, which can speed up recovery and prevent recurrence. Physical therapists play a key role in managing plantar fasciitis. They assess your foot mechanics, flexibility, and strength, then design a personalized exercise program. Therapy focuses on stretching the plantar fascia and calf muscles, strengthening foot muscles, and improving overall foot function. Early diagnosis of plantar fasciitis is crucial for effective treatment. The sooner the condition is identified, the quicker you can start interventions that relieve pain and prevent chronic problems. Delayed diagnosis can lead to prolonged discomfort and more complicated recovery. If you suspect you have plantar fasciitis, pay attention to your symptoms. Note when the pain occurs, what activities make it worse, and whether it improves with rest. Keeping a symptom diary can help your doctor make an accurate diagnosis and track your progress over time. It's important to consult a healthcare provider if your heel pain persists for more than a few weeks, worsens over time, or interferes with daily activities. Early medical attention can help prevent complications and ensure you get the right treatment for your condition. To sum up, diagnosing plantar fasciitis involves a combination of symptom review, physical examination, and, in some cases, imaging studies. Doctors look for classic signs like morning heel pain and tenderness at the heel. They may also assess foot structure, gait, and footwear to identify contributing factors. The plantar fascia is a key structure in your foot, acting as a shock absorber and supporting the arch. Its health is essential for pain-free walking and standing. When inflamed, it leads to the classic symptoms of plantar fasciitis. Inflammation is the body's response to injury or overuse. In plantar fasciitis, inflammation of the plantar fascia causes pain, swelling, and tenderness. Reducing inflammation is a key goal of treatment. A heel spur is a bony growth on the underside of the heel bone. While often seen in people with plantar fasciitis, it is not usually the cause of pain. Understanding the difference helps avoid unnecessary treatments. Overuse injuries occur when repetitive stress is placed on a body part without enough time for recovery. Plantar fasciitis is a classic example, often seen in athletes or people with physically demanding jobs. Gait abnormalities refer to unusual walking patterns that can put extra stress on the plantar fascia. Identifying and correcting these issues is important for both diagnosis and treatment of plantar fasciitis. To better understand plantar fasciitis, let's visualize the anatomy. The plantar fascia runs from the heel bone to the toes, supporting the arch and absorbing shock. Inflammation or tiny tears in this tissue cause the classic symptoms of plantar fasciitis. Let's break down the diagnostic process for plantar fasciitis. It starts with a review of symptoms, followed by a physical exam focusing on the heel and arch. Imaging studies are only used if the diagnosis is unclear or symptoms persist. The windlass test is a simple clinical maneuver to diagnose plantar fasciitis. By dorsiflexing the big toe while standing, tension is placed on the plantar fascia. If this reproduces heel pain, it supports the diagnosis. In summary, plantar fasciitis is a common cause of heel pain, especially in active adults and those with certain risk factors. Diagnosis relies on a careful review of symptoms and a thorough physical exam, with imaging reserved for complex cases. Early recognition and treatment can lead to faster recovery and prevent chronic discomfort. If you suspect plantar fasciitis, consult a healthcare professional for proper evaluation and guidance.